Welcome back. The time is now 6:44 a.m. All right, Caitlin, I want you to brace yourself for this story. Your mom probably often reminded you growing up to brush your teeth, right?
Yes, very important.
Well, now the Dublin VA is doing the same thing because it turns out it's that kind of advice that could actually save your life.
Oh, moms are always right. Our morning reporter Taylor Hicks is in studio to tell us about a program that is cutting down on pneumonia cases by focusing on better dental care. Good morning, Taylor.
Good morning, Caitlin. Wanya and Caitlin, the Carl Vinson Medical VA Center launched a program to tackle pneumonia. Surprisingly, it starts with brushing your teeth, and it turns out that it can also prevent a lot of other potentially deadly health problems. They're already seeing results. Months ago, the Carl Vinson VA Medical Center saw a high number of pneumonia cases.
We were like 110% over national average.
Michelle Lord, dental hygienist at the VA, says since February, the number of pneumonia cases at the hospital dropped significantly, and now
where we're actually below national average. The month of July, we had 0 cases.
Lord credits their new program called HAPPEN.
HAPPEN actually stands for Hospital-Acquired Pneumonia Prevention by Engaging Nurses.
The goal is to improve oral care among veterans staying at the VA, as well as those staying in the medical surgical unit, in hopes of reducing hospital-acquired pneumonia.
When a patient is admitted into the hospital, they, within 24 hours, especially if they're going to have to stay over for a long period of time, within 24 hours, the bacteria in the mouth multiplies 5 times. And if you're staying 48 hours, your chances of getting pneumonia are increased.
Lord says the last thing on a patient's mind when they are struggling with other health issues is to brush their teeth.
What happens is when they go several days without taking care of their oral care, the bacteria in the mouth can be aspirated into the lungs.
Lord says reducing hospital-acquired pneumonia is even more important with the high number of COVID-19 cases.
You don't want your lungs to be compromised in any kind of way, and if you are in the hospital and you end up catching pneumonia alongside of COVID, your chances, sadly, of making it out is probably decreased.
Through HAPPEN, VA nurse managers learn to train their staff to keep tabs on oral care of patients there. They will also help veterans with their oral hygiene each day and teach them why it is so important.
I believe if you explain to them that it's not just to clean their mouth or to make their breath smell good, it could save their life.
Lord says that this doesn't only apply to veterans, it's important for you too. She says the biggest way to prevent other health issues is to brush your teeth twice a day, once in the morning and once at night. Wanya and Caitlin, back to you.
All right, thank you, Taylor. Yes, twice a day, and make sure you floss too.
Exactly.
Always important.
Floss it out.
We also spoke with Brandon Kirshner, an internal medicine physician at Piedmont Macon.
And he says not only can poor hygiene lead to pneumonia, but it can also lead to cardiovascular disease, strokes, and heart attacks. So with that being said, word to the wise. You heard it on 13. Brush your teeth.
Yes, before you go and leave the door this morning,